Hello, the internet! It is Saturday, the 8th of June, 2024, and welcome back to the channel. I've got a stitcher left in my stitches. No, I had a skin cancer removed from here, approximately here. I cannot show you this. I cannot take my shirt off. That's a YouTube thing. I cannot just take my top off on stream. As weird as that sounds, unless it's in situation, such as maybe you're out there surfing, then you can have your shirt off. But sitting at a desk, a streamer cannot remove their top. Just like a female streamer cannot remove her top, a male streamer cannot remove his top. That's just the way it is. But I can show you photos of what I'm talking about, because what I want to do here today, I want to work out whether having a stitch, see, I want to say stitch, but it's spelt stitcher. It's spelt S-T-I-T-C-H. And so therefore it's said stitcher. But I always say stitch, but don't forget the extra T, stitcher. So I want to find out whether it's okay to remove your own stitcher using a pair of tweezers, or do I have to go back to my doctor to get them to remove it? I don't want to go back to my doctor because of two things. The first thing is, when I was there for the first stitcher removal, so how many were there? There was 1, 2, 3, 4, 5, 6, 7, 8, possibly 9 stitches in the original stitcher. And he pulled them out, and even though I didn't watch him do it, I'm pretty damn positive all he did was get a pair of these and just pluck those suckers out. He didn't give me anything, like there was no sterilizing, there might have been a bit of dabbing of something, but there was no anesthetic. It was just, okay, these are ready. And it was all over and done with within a minute or two. And that's why I think he might have missed one, because he wasn't rushing, but it wasn't a very difficult process. So I want to find out whether it's a thing that I can do, and I'm going to do it here on stream, even though I'm going to turn my back so that you don't see it, but I'm going to do it. With that in mind, hello Dougski in the chat. TV's on, phone for the chat. Are you ready? Yeah, Doug, by the way, later on, we'll do a call-in if you want on Kick. We'll come back and do a music stream with a call-in, because you've got news I know you want to tell the viewers. So let me cut across and show you what the original stitches looked like. So here we have well, I'm going to zoom in on that, make it a little larger. This is the original area of interest. So I had a skin cancer cut out, and in here, underneath here, there is actually internal stitches. And then on the surface there are, so the internal ones are the dissolvable ones, and the ones on the top here are non-dissolvable. Now you can see a clear example of what it looks like by this one down the bottom here. This is what the actual stitcher or suture, they call them a suture. That's a strange word to say, a suture. That's what it looked like. Now, of course, I had them removed. And so this is where we are. By the way, that photo, that original photo, was on the day of the stitches going in. So that's about 4 weeks ago now, 3.5 weeks ago. This photo is just taken about 3 minutes ago. So what I'm illustrating, and if I zoom in on a better one, what you can see, and if I get my finger in there, you probably can see it the best in this shot. There is a stitcher right there that is still remaining. And how do I know that's remaining? Because when I rub my finger over it, I feel it. I feel the sharpness of it. There's definitely a sharpness there. Now, actually, just looking at that, I know it's a shitty photo, but looking at it, it kind of looks like that might be one of the internal ones, because it's kind of poking its head up from inside. If you go back out, is it poking up from inside? Or is that just the way it appears? I don't know. That could be, I mean, well, no, but they're dissolvable. It's been like four weeks. That can't be one of the internal ones. That can't be. Either way, I want to get it out. I want to do it on stream. I first of all want to find out whether this is something that I should do. So I'm going to ask ChatGPT. I'll just do that now by asking it, is it safe to remove your own stitches? It says here, removing your own stitches is generally, oh geez, it's really spitting out a whole bunch of text here. Slow down, crikey, holy shit, it's giving me an entire, okay, I thought that would be like a one dot point, but it's giving me a whole bunch of instructions. Here we go, let me read it out. It says, removing your own stitches is generally not recommended and should ideally be done by a healthcare professional. We know that. However, if you are in a situation where you cannot access medical care, okay, so I'll stop there and say I can certainly access medical care. There's no dramas in Australia. You can just go there. You got to make an appointment. But the problem, or the reason I don't want to do it, and I think I tried to get to this point before, was I feel like that's taking up the doctor's time. It's taking up potentially another patient's slot, that it might have something more important to deal with. And because I went in there and got them, the first ones removed, and I saw, or I know what he did, just pluck them out, I feel like it's a waste of everyone's time. So it's kind of why I don't want to bother him or anybody else. It says, however, if you're in a situation where you cannot access medical care or you need your removal, it's crucial to follow these guidelines to minimize the risk of infection or other complications. Okay, before you begin, consult with your healthcare provider. If possible, consult with a doctor or nurse to confirm that it is safe to remove your stitches. I'm consulting with Nurse GPT. Ensure the wound has healed enough to justify removal. That's a good point. And I feel like just looking at my wound, I feel like that has healed, right? That's certainly enough. Like it's almost gone, right? Doug, is the stitch looped and therefore needs to be cut so it can be pulled out? I mean, that's a good point. Could be. Can you tell by looking at that? It's such a bad photo, like in terms of the resolution. Yeah, that's a good point. It might need to be cut first. Good question. Good point. Well noted. Let me continue with the GPT nurse. It says, prepare your supplies. You will need sterilized scissors, tweezers, antiseptic solution like alcohol or hydrogen peroxide, sterilized gauze or bandages, and clean water. I've got two of those things. I've got the tweezers and I got water. Step-by-step instructions. Wash your hands thoroughly. Use soap and water to clean your hands. Well, I just had a shower. That checks out. To prevent adding bacteria to the wound. Well, there's no wound. It's a clean wound. I don't know, just saying, yeah. No, it's a good point, Doug. Good point. It says clean the wound area. Gently clean the area around the stitches with an antiseptic solution. There's nothing. Okay, I feel like it's clean. Sterilize your tools. If not pre-sterilized, soak the scissors and tweezers. I just combined those two words. What did I say? It's tweezers. The tweezers in alcohol for at least 10 minutes. Well, the only alcohol I've got, and I'm not wasting it, is this Jack Daniels. I'm not wasting it on that. Hell no. I could just run it under boiling water, I guess. That's probably one thing that I probably should do. Run these under boiling water. It says, remove the stitches carefully. Using the tweezers, gently grasp one end of the stitcher. Snip the stitch with the sterilized scissors as close to the knot as possible. Gently pull the tweezers, pulling in the direction of the stitch to minimize skin damage. Repeat for each stitcher. I can't even see a loop. I can't see a loop. All I can feel when I'm touching this, all I can feel is, to illustrate with this larger item, all I can feel when I put my finger on it is I move it back and forward and the stitch just moves like that. That's all I'm feeling is the top of the stitch. Clean the wound once all stitches are removed. I'm only removing one. Clean the area again with antiseptic. Apply a bandage. Cover the wound with a sterilized bandage. to protect from infection. Aftercare, monitor the wound. Watch for signs of infection such as redness, swelling, warmth, pain, or discharge. If any of these occur, seek medical attention. Keep the wound clean and dry. When to seek medical help. If the wound is not healing properly, if you notice signs of infection, if you experience significant pain or discomfort. Here are the risks of removing your own stitches. You might get infected without proper sterilization. There's a high risk of introducing bacteria. Improper healing. You might remove stitches too early. That's not a case. If anything, this is too late. It's been like 3 to 4 weeks. Pain. The process can be painful, especially if the wound is not fully healed. The wound has completely healed. Conclusion. While it is technically possible to remove your own stitches, it is generally safer to have a healthcare professional do it. They can ensure that the wound is properly healed and the removal process is done in a sterile and safe manner. So the main thing I'm seeing there is sterilize. Excuse me, hold on a second. I am going to go and get some boiling water and just dose these in boiling water. That's the main criteria, because I check off this is already healed, there's no infection. To me, it feels like I could just grab the thing and just pop it like that. It might be a little difficult, but I reckon I could grab it right now and just do it. I don't even need to. I mean, I probably should. I mean, I've read everything. I should sterilize them. But I think the sterilizing thing is talking about if you're going to be going in to like an open wound. I'm just going literally onto the surface of my skin. Like I'm just going onto the top of this and just grabbing that and plucking it out. But I will do the thing. I will sterilize it. What I'll do while we're here, I did find, of course, a couple of YouTube videos to help me through this process. I guess the first one is talking about the stitches that were underneath this wound, because the doctor did put dissolving stitches and then the top ones. So the top ones are the ones that need to be removed. They're non-dissolvable, but there are dissolvable ones underneath, which, given that it's been 4 weeks, I would assume that they're fully dissolved. Here's a YouTube video that says, how do I know my stitches are dissolving? Let's find out. Can we play this thing? We will.
How do I know my stitches are dissolving?
Our goal is your satisfaction. Let us show you the way.
Wow.
Generally absorbable sutures are clear or white in color.
Oh.
They are often buried by threading the suture under the skin.
They're often white in color. Interesting. Or clear. This is definitely a clear or white one. Ah. I reckon this is one. Dude, I reckon this is a dissolvable one. Let's go back to the image. That's concerning. Where are, oh, this is full screen. Where are the images? Here they are. I reckon this is a dissolvable one. If you look at this image here, although they're, okay, maybe I'm wrong. These are all white ones, even the top ones. I wish that my hairs weren't there, you know. I'm getting confused with what's a stitcher and what's there. Okay, so they're all clear. Dugsky, aren't the top stitches black in generally? That's what I would have thought, but looking at this clearly, these are not black. These are white. I mean, you know, I'm not getting that wrong, am I? That's pretty much as far in as that goes. But these are definitely, that's a white stitcher on top. That's a white on top stitcher. That's definitely a white stitcher. That's 100% a white stitcher on top. Okay, so I reckon these are white or clear stitches on top, and the dissolvable ones underneath it, which you do not see, would also be white. So with that in mind, I think we're good. But that just kind of concerned me when I read that, or when he said that.
Edges and are only visible as threads coming out of the ends of the wound.
Generally, absorbable sutures are clear or white in color. They are often buried by the threading the suture under the skin edges and are only visible as the threads coming out of the ends of the wound. The suture end will need snipping flush with the skin at about 10 days. I think you're right. Yeah, I reckon I'm right too.
The suture end will need snipping flush with the skin at about 10 days.
Okay. So how to remove your own stitches. This is by a channel called Dr. Sagar Patel.
Hey everyone, Dr. Patel
Whoa, Docky, it's loud.
here. Today I wanted to show you, whether you're my patient or not, how to remove your post-operative stitches on your own.
Wow.
First, a disclaimer. This is not medical advice.
This is not medical advice? You're a doctor. What other advice is it? What the hell? What's wrong with this? What's wrong with YouTube where this guy has to say this is not medical advice? You're literally a doctor. This can only be called medical advice. Unless you're going to have your medical knowledge and not use it to tell us what you're about to tell us, this is 100% medical advice. Unless he goes, now I know exactly the process, but to do this YouTube video, I can't tell that process because that would be medical advice. So I've got to tell a varied version of that. You know, when crypto streamers, myself included, say, hey, this isn't financial advice, that's because we're not financial advisors. That's because we are a YouTuber. That's why we say that. But this guy is literally a doctor, and yet he's saying this is not medical advice. That doesn't make any sense. That does not make any sense at all. Let me just read it back again.
First, a disclaimer. This is not medical advice, and you should seek the advice and counsel of your surgeon prior to removing your stitches. For my patients, if you're about 7 days after a chin liposuction procedure and I've okayed it, this is how you can remove your own stitches.
So yeah, if unless you come into the surgery here, I'm not a doctor.
Before you begin, there's a couple of things you need. I use a typical suture removal kit. This is something we have in-house, but I know you're more likely than not going to have that. But this is a little eyebrow scissor and tweezers that you have at home, and
Fair enough.
You can use them likewise. The first thing you can do is you can either use an alcohol pad or you can use some hand sanitizer to just clean them. I know everybody has hand sanitizer now.
Oh, that's a good
So
idea.
you just put a little bit of that on there. These have been pre-cleaned, but we're going to double clean them. And go ahead and clean the tips of both instruments.
That's a good idea.
With the alcohol. And if you don't have that, you can use an alcohol pad. Don't use any vodka, rum, or tequila. The second thing you're going to want is a little bit of peroxide. If you spray a little bit of peroxide on a little 4x4 or dip it in, you can use...
In Australia, a 4x4 is a off-road vehicle. Just saying.
Use that to clean the incision prior to taking out the stitches. Last but not least, if your surgeon or your procedure required the use of any glue over your incision, some typical Goo Gone, which you can buy on Amazon, the link will be below, can be applied to help remove any of the surgical...
Do you reckon that's an affiliate link? Goo Gone? Doesn't look like an affiliate. Oh, no. Looks like it could be an affiliate link with all the extra jargon there. I mean, he's a doctor. Does he need to have Amazon affiliates? And if it is, it's got to tell us that he's got to disclose it. I earned from this. Okay.
Adhesive. So the first thing we want to do is have a look kind of at the incisions. So we're going to do... I'm going to lay it back. This is our lovely patient who just had chin lipo last week.
Chin liposuction.
You're going to want to be in a position where you can visualize everything. And the first thing you're going to do is have a look at what we're doing. So this is a single stitch at your earlobe incision. You can see a little bit of dried blood. So we're just going to clean that off with a little bit of peroxide. And now you're going to be able to see
chin lipo. So that goes from your ear to your chin. Interesting.
this stitch. If you want to come on in here, this stitch is holding. And now here's the key. You can see that as I rotate it, there's two different ends to it. Now, what you don't want to do is cut both. You want to just cut one. And then you just pull it.
Well, mine doesn't look anything like that. Mine does not look like that at all. Mine just looks like a thing sticking straight out of my skin.
Now, after you're done, make sure there's no splitting and use some ointment. That will be invisible in no time. Now coming on over here, you'll see these two stitches. Go ahead and turn your head. So this is a very clean. Now what I want to do is show you if you for some reason accidentally cut both. What happens is that you're going to leave a little bit of blue in the skin.
Ah.
As you can see right here, there's a little bit of the stitch that's been left behind. That's very important to not leave that in there.
That's what might have happened here. He might have done the double snip, and that's why I can feel just one tip. Yeah, that could be that.
So you're just going to want to tease the skin until you get that out. And then once you get that out, you're good to go. But like I said, in the ideal world, you don't cut both. You cut just one of them.
Okay.
Grab this stitch, pull it up, find your scissors to go into one end.
Yeah, there's no
remove it.
There's no finding any ends on mine. Mine, I want to show it. I just want to take my shirt off. There's just one thing popping up. I reckon that's what's happened here. I reckon he's cut both ends and taken one and left one. But what's holding it in there then? I should be able to get that out. That should just pop out pretty easily. It's been like the wound's fully healed. It should just be, if I don't get it out now, it's just going to grow over it, right?
Okay, and don't forget to get your last earlobe stitch out.
Okay, if he's going to play that funky music, I'm out. I reckon I'm good to just go and sterilize this and just sort of try to pop that out. So what I'll do is I'll go and sterilize it, and I'll be right back, and we'll get into Dr. Surgery, Gives Surgery. Be right back. Hey, Pertsky, good evening. Hello. I'm coming in late, but I'd advise against this. Really? Well, you better have... do you have a good enough reason? I'm just going to put some Sani on this. What's your reasoning for that, dude? Okay, it's got some sanitizer here. Probably put too much on there. Nobody saw that. I just wiped it on my jeans. So I'm going to just sanitize it as best as I can, the ends. How you doing, by the way, Pertsky? What's cracking? Also, I know it's a simple thing, but you might end up with some left inside. Also, the doctor should see he's screwed up. That's a good point, I guess. Yeah. All good. How about with you? Yeah, I'm good, man. Aside from a stitch remaining. I kind of agree with that the doctor should see that he messed up, but I'm not really about teaching him a lesson or anything. I just want it to be done. So what I'll do, if it remains inside, it could lead to infection. Yeah, that's why I think I can just get the end of it and just pop it out. I'm gonna give it a shot anyway. Like, I mean, if it all goes foul, I'll have to go and get it sorted. But I'm gonna give it a shot. So what I'll do is, I guess I'll just turn the GoPro on so you get the reverse shot. And I'll just turn around this way, so I'm not allowed to show you my chest, but you can see that the process is happening. And I'll just grab the end of it. Dude, it came out like... It came out so freaking easily. I don't know how well you can see that. I'll get a shot of it and I'll send it across. I'd still be worried if it's looped. Dude, that came out. Like, I feel like I could have wobbled that back and forward enough and it would have just wobbled itself out. Let me get a shot of that. I'll try to get a nice zoomed in shot to show you yahoos what it looks like. Dude, even with these glasses on, I don't think I've got good eyesight. Let me send this photo over. I reckon we sorted it pretty much very easily. Sending it across. Oh, I didn't check for any bleeding or anything. Let me just check for bleedings. Turn around. Turn around. No bleeding. And I'll put a little bit of sterilizing on there as well. No chest activity. He must have cut it beforehand and forgot to take it out. That's what we were saying. I reckon he did the double cut and just left it there. Let me show you this second or this new image. Where's my downloads? The new image. What's it? Here we go. It came out so easily. Check this out. That's not zoomed in enough, is it? Let me make this larger and zoom in on what that actually was. You can't really see, but that's all it was. And that's as good as I can see it too, because it's blurry as shit to my eyes. But whatever that was came out very, very easily. It's, you know what it is? Looking at it now, I can see it's the loop end. It's the loop and a knot. That's all that is, a loop and knot. Potsky, it's pretty troubling that a doctor would make such a stupid mistake. Well, yeah, you could say that. You could say that. I mean, you did say that, and I agree. I agree with you. It's a bit concerning, but he's a very good doctor, you know, like he's a real nice guy and he's really pleasant. And I don't know. I mean, I just was sort of feeling around there. I was like, man, there's still something crunchy there. It's still a little bit crunchy. Now it's not. Now it's all clear. So I reckon I'm good at that point, and I think we're good to go from here. Dougski, if you're still in the chat. How about what time suits you for an afternoon? We'll do a shunting 5 and we'll do a call in. What time's good for you? I mean, I'd usually do it the 3 o'clock till 3 till 6 kind of thing. But if that's good with you, we'll do that. Yeah. And thanks everybody here for their thoughts, helping me walk through this. You know, certain medical processes you can probably handle yourself. That one there, I feel like it's nothing really like. And I feel like if I had have gone to the doctor, he would have just gone, oh, left one in, done. Normal time is fine. Okay, cool. Well, so yeah, we're going to have Doug's going to call in later on a kick stream. He's had some changes in his situation and he's keen to tell us about it. And he's also got a Shunting 5, volume 24, I believe. I can't remember what number it is, Doug, but I've got it there. It's all in order. And so, yeah, if you want to join us on Kick later on this afternoon, that'd be great. I'm going to now go and work on Govan. I'm going to work on mosquito fly screens. I'll explain that once it's all done, but I've got some work to do on that. So I'll see you all later on skis, on the Kick machine skis. And cheers to everybody. And remember, it's Stitcher with a second T. Stitcher. Cheers. Stitcher in time.